Welcome back to Healthy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson, and we're talking today about cardiology. We're looking at heart disease, prevention, diagnosis, and treatment. We've talked with Dr. Reed and Dr. Stalls, and now we're talking with Dr. George Antoun. Welcome to the show.
Thank you.
Really glad to have you here. Maybe tell us a little bit about your background before we get started.
All right, so I was born and raised in Lebanon, in Beirut, the capital. And I went into high school and I graduated in 1999. And then I went into med school and did it for 6-7 years, and I graduated in 2006. I always dreamt to come to the United States, and I came to the United States to study medicine, and I got here in 2007. And I did internal medicine residency in East Tennessee State University. And for 3 years, graduated in 2010, and then after 2010, I decided to go into cardiology. I did extra 3 years in the same university, ETSU, and I graduated in 2013. And during that time, I decided to go into interventional cardiology. So I had the luck to go into interventional cardiology, and I went for 1 year to Detroit in Henry Ford Hospital, and graduated in 2014. And after then, I came here to Louisiana, and I've been practicing ever since 2014, and here I am in St. Tammany.
Outstanding. And I think that it's interesting that interventional cardiology is the way that once things have gone wrong, we can really get in there and straighten some things out, but it's also where so much of the innovation in cardiology is coming in. I think, we have talked about electrophysiology with Dr. Stalls, and I think there are lots of other types of intervention. So if you can maybe explain a little bit of some of the other types of intervention that you might describe or that you do for patients.
Absolutely. It's very simple. The heart is a simple organ. It's a muscle that has structures. So if you look at it, it's a structure that beats every second. It gives you a heartbeat. So it's a pulsatile pump. So that pump, like any organ, it needs blood flow in order to function well, and that's the job of the coronary arteries. Coronary arteries are the pipes that bring blood flow to the heart muscle in order for that muscle to stay beating. So this is one of them, and then as I mentioned, it's a structure. So this structure is a pulsatile structure that brings blood and makes the blood flow in only one direction throughout the human body. So in order for that blood flow to go through it in one direction, it has to have some valve structures. So really, other than electrophysiological procedures, so we have the coronary procedures and you have the structural procedures. So those are the three major procedure types in cardiology. So I deal with coronary interventions, so really basically dilating coronary arteries that are getting blocked, because blocked coronary arteries can lead to cardiovascular events, including death, stroke, heart attacks, and the structural intervention. The most common one is a transcatheter aortic valve replacement nowadays, because it's been really booming. So those are the other procedures that we majorly. There are other procedures that are still there. They're more sophisticated. So that's it. The structural procedures and coronary procedures.
Structural and coronary, and you just rolled transcatheter, transaortic. Go ahead, say it.
The TAVR. So other than coronary angioplasty, that nowadays there's a structural heart disease interventions. So in 2002, ever since that first transcatheter aortic valve replacement was done, innovation has happened significantly and progressed throughout the years. So historically speaking, aortic stenosis is a very common disease. In fact, after the age of 80, they say there's almost 10% of the population that has some sort of aortic stenosis. The aortic valve is the front door valve of the heart muscle. As I just mentioned, the heart is a pulsatile pump, so it has to fill and then to pump. To fill, you have the back door valve that opens, which is the mitral valve, the left ventricle, and then the front door valve is the aortic valve, and it has to pump through it. So narrowing of this valve can pose problems for the left ventricle, the main pump, and if this problem continues to progress, it gets to a point where the heart does not function well. So people can experience breathlessness, shortness of breath on exertion, sometimes congestive heart failure, symptoms like swelling in the legs, fluid in the lungs, and sometimes they can pass out from it, and sometimes they can die from it. So the idea is, because it's a disease that affects the elderly population, so a lot of people, when they get to that age, they are not candidate for open heart surgery, because classically open heart surgery is the way to fix those valves. But ever since 2002, after that first transcatheter aortic valve replacement that was done, I think in France, so the idea is you go through you deliver a valve that is crimped on a balloon across the diseased valve, and you inflate the balloon, and you basically push that previous valve to the wall, and now your new valve is working. So basically you open that hole that is narrowed. And once you do that, they found that doing that, there's improvement in symptoms, less risk of death, and it's really, it's changed the whole pathology of severe aortic stenosis. And you know, once that procedure has improved, now in the past you used to do it only on very high-risk patients, and now on high-risk patients, now on moderate-risk patients, and the valve's just getting better.
That's amazing. The valve is getting better, and your ability to insert that valve through minimally invasive procedures means that people who would have faced an open heart procedure are now just faced with that minimally invasive experience, and people who were not strong enough or whose risk factors were too high to have an open procedure are candidates for valve replacement because it won't be an open procedure.
Absolutely.
That's pretty fascinating. And I think Dr. Stahls was talking earlier about how fast technology is changing in cardiology, and I think TAVR is a very good example of that.
Absolutely, no question about that.
So I think we were talking about how the valve replacement works in minimally invasive, and that's TAVR. But there's also angioplasty, and that existed long before TAVR existed. And TAVR's technology is a little bit based on that, isn't it?
Absolutely. You know, it's basically opening a narrow space in the vasculature. So whether it's the aortic valve or the coronary arteries. So coronary arteries, I mean, again, heart disease is still the #1 killer. Heart attacks do happen, and they still do happen. Heart attacks happen when you have a blockage in the heart artery that decides to rupture and a clot forms, and then the blood, you have sudden cessation of blood flow to a part of the heart muscle. It all depends on how big is this heart muscle. That's what we call area at risk. If it's a large heart muscle that's at risk, you may die at home from a heart attack. So the idea of angioplasty is you go and where this vessel decides, you know, when you have a blockage in that vessel, you open it up. We usually leave a stent nowadays. In the past, used to be just only balloon angioplasty when it first started in 1977. But nowadays, technology improved, and now you can leave a stent. So a blockage that was 70% becomes 0%. And you're basically preventing, if somebody comes with a heart attack, you fix the blockage, you know, you're making them live longer, you improve mortality and make them feel better. And the most important thing is the heart muscle itself. You save a lot of heart muscle, and saving heart muscle, that, you know, means improvement in quality of life and improvement in longevity. And so, yeah, angioplasty has also gone a long ways.
Wow. Well, Dr. Antoun, I really appreciate you coming in today to talk about these types of intervention. It's been really educational.
Thank you so much. Appreciate it.
You're watching Healthy Living, brought to you by St. Tammany Health System. We talked today about cardiology, and we hope that you'll join us for a future episode of Healthy Living.